All right, welcome everybody to STEM Careers Beyond MD and PhD. We have four wonderful speakers today who will share a bit about their careers and how they got there. And of course, we hope that you will ask plenty of questions and see how much you can learn. I encourage you guys to follow the LinkedIn page, which is where we post our upcoming workshops, but we also share opportunities, research opportunities, summer opportunities, scholarships, etc. And then YouTube channel is where you can find our past workshops. In particular, this is the third year of the series, and so you can find past speakers on our YouTube channel. As I mentioned, we typically just record the presentations, so the Q&A will not be included. But if there's a career that you're interested in that we've already presented, you can go and find it on our YouTube channel. It's just the HBCU mentoring program on YouTube, or you can, of course, scan the QR code. All right, so we're going to jump right into it with our first speaker, Jennifer Shipman. Welcome.
Hi, everyone. Can you hear me okay?
Yes.
Okay, great. Thank you so much for joining me. I'm really happy to be with you today. Thank you to Janelle for inviting me. So my name is Jennifer Shipman. I'm an associate principal scientist at Merck at our West Point site. So if you flip to the next slide, I'll tell you a little bit about myself. So as far as my personal profile, I married my college sweetheart. We went to undergrad together in June of 1997, and I thought this would be funny to show you. In 1993, we went to a family friend's wedding when we were young. And then 30 years later, there we are underneath at a family friend's daughter's wedding. So I'm now attending the weddings of my friend's children 30 years later. I have 3 kids, 2 human, 1 canine. So my son Corey is 23. He graduated last April with a BS in molecular biology from the University of Pittsburgh. And he's working towards his MPH now. He'll finish in May. And interestingly, Corey was part of Merck's 2024 intern class. So I wanted to point that out because I have a lot of experience with Merck's internship program, both as the mom of an intern who has gone through it, but also professionally, I have worked with interns on our intern selection committee, for example, and I've also mentored interns in my group. So I'm happy to answer any questions about Merck's internship program. As sort of a follow-up to that internship, he was very fortunate to be offered a contractor position. So he currently works for Merck about 20 hours a week from Pittsburgh remotely while he's finishing his MPH. So it's been a great opportunity for him. My younger son, Derek, is 19. And he is a freshman at Lehigh University in their integrated business and engineering program. And then we have Kip, who's 8, and he's the best dog ever. So some things I like to do just to kind of give you a feel for who I am as a person. I really like to do cross-stitch embroidery. So the picture on the right-hand side is my son, Derek, and his girlfriend buying a Christmas tree. And I recreated that portrait into a Christmas ornament that I stitched by hand for him to give to his girlfriend for Christmas. I'm a huge Steelers fan. I grew up in Western Pennsylvania. And that picture on the bottom is of me and my whole family on the ferry on the way to a Steelers game. They may have been playing the Ravens. I don't know, but we always like to go to Ravens games. And I also serve as an election official in Bucks County. So I work at the polls on election day, checking voters in and making sure the polls are working smoothly. So to give you some idea of my career pathway, I graduated way back in 1991 from high school. I went to a very small high school that did not have an AP program. So I was not able to get any college credits for my science classes, but that's really where I discovered my love of biology. I had 2 really good biology professors. And so I started at Juniata College shortly after, after graduation from high school. And during the summer between my junior and senior year at Juniata, I did an internship at the Penn State College of Medicine, the Hershey Med Center. And that was my first real research experience and where I really learned that I love lab work. So that was profoundly impactful for my future career path. When I graduated from Juniata, within like a month, I got a job at the Johns Hopkins University School of Medicine in Baltimore, where I worked in the Department of Oncology. And my PI was a medical doctor who saw patients half of his time and spent the other half of his time running a lab, and I was his research assistant. So that's really where I learned pretty much everything I know about working in a lab. At the same time that I was working, I was also working towards my master's degree in the biotechnology program. So that was a part-time program at Hopkins, where I could work during the day and go to school in the evening. So that took about 3 years to complete that master's degree because I was doing it part-time. When I graduated from Hopkins, I then moved to West Point, Pennsylvania, and started working at Merck. I started in the Department of Cancer Research, which was a job I really loved. It was very connected to my background from Hopkins in the Department of Oncology. But unfortunately, after about 5 years, Merck moved all of its cancer research operations to Boston. And so I didn't want to go to Boston. And so I decided to take another job within the university, within Merck. And I thought, let me try working outside of a lab and see if I like it. So I actually joined the Department of Worldwide Product Labeling, which is a regulatory department, and it's the department where the physician circulars are written. So when you get medicine and you pull that paper out of the box, we were the department that wrote that text. And so I did that for a few years and decided that really wasn't for me, and I wanted to get back in the lab. And so in 2006, I joined the Department of Protein and Structural Chemistry, and I have been there ever since. And so in 2023, I was promoted to Associate Principal Scientist. And so I now lead a group at Merck. I lead our Cell Sciences group where we do all of the protein expression. And so if you flip to the next slide, I'll kind of explain what structural chemistry is. So at Merck, we call it structural chemistry. A lot of places call it structural biology. So you might have heard it called structural biology. But what is it? In order to treat or prevent disease, we first have to know what protein contributes to that disease state and how that protein looks in its native state. So that's its three-dimensional state physiologically. And so we solve that 3D structure. And I'll show you more about how we do that in the next slide. But we use that three-dimensional structure to develop molecules that can interact with that protein target, either to inhibit or activate that molecule to solve a disease state. And so the two primary methods we use are X-ray crystallography and cryo-electron microscopy. So down there on the left-hand side, you see this schematic. That would be sort of a representation of the SARS-CoV-2 virus. And you can see that spike protein. And so that's kind of a zoomed out view of what that spiked protein looks like in its three-dimensional state. And then that middle picture there is sort of zooming in and seeing how a drug substance might bind within the binding site. And so on the right-hand side, that top picture is a representation of X-ray crystallography, where you crystallize the protein that our department purifies, and you shine a X-ray on those crystals, and you can solve the structure that way. Or the bottom method is cryo-electron microscopy, in which the protein is spotted onto metal grids, and then they're put in a very powerful electron microscope. And that picture down there in the right-hand corner is some representative images that you would see. And so we can solve the three-dimensional structure that way. And so this is sort of a very busy slide, but it just shows you the iterative cycle that we go through in our protein and structural chemistry workflow. So that pink arrow up at the top represents the design cycle. So we design lots of different DNA constructs that have different elements of the protein that we're trying to study. And then those are cloned. We usually use a outside vendor to make those pieces of DNA. But then this green box down here is the portion of the department where my group sits. So we do high throughput protein expression. We use insect and mammalian cells, and then we do first pass purification and analysis. What's really fun about my job is we get to work with some really cool robots, and they're kind of represented there in those pictures. And then after we find the constructs that we like, we scale those up and they go through purification by a whole host of different pieces of equipment, and a group that we hand off to, which are protein biochemists who purify that protein, which is then handed off to our structural chemist colleagues, who then solve the structure. And that's kind of a summation of our workflow. I'm happy to take any questions if there's any time at the end. So thank you to everybody for joining me. And here's just a picture of some former and current lab members. I will note that in this picture, the young woman in the orange shirt was an intern, a summer intern, and the woman in the sort of tan sweater was a co-op. And so we have had co-ops and interns in our lab. And again, I'm happy to answer any questions about Merck's program.
Thank you so much. All right. Thank you. So we'll move right along to our next speaker, who's going to speak about dosimetry, Betty Floreza.
Hello, my name is Bethlehem Floreza. I am a medical dosimetrist at the Sibley campus in Radiation Oncology Department. Can you guys hear me?
Yes.
Okay. So just to give you a little bit about me, how I got to where I am right now is that I was a radiation therapy student at Howard University, and how I came to learn about dosimetry was through my clinical rotation when I was a therapy student. Once I saw dosimetry in the radiation therapy department, that's when I felt that the therapy would be a stepping stone for me to get into the medical dosimetry portion of it. At that time, I'm old, sorry. So at that time, there wasn't any medical dosimetry school. Everything was being trained through your radiation therapy. After practicing radiation therapy in clinic, the dosimetrist or the physicist within the department would train you to become a dosimetrist. And once you have a certain amount of experience, you will go ahead and sit down for your examination. However, that had changed. There is no more of on-job training. You will actually have to go through school to actually become a medical dosimetrist. So what is a medical dosimetrist? A medical dosimetrist is a healthcare profession who specializes in planning and calculation of the radiation therapy treatment. Our goal is to aim the beam to treat the target area while minimizing the normal surrounding tissue from it. To the right, you see the radiation therapy machine. This is just one of the type of radiation machine that we widely use. Next slide, please. So how do you, like I said before, during my time, there wasn't any school that you would have to go through. It was through the training of on job, and then you sit down for your certification. However, that has stopped, and you would actually have to go to a school now, and that started in 2012, where 2011, 2012 is when they required everybody to go to school in order to become a medical dosimetrist. And there's two ways of getting to the dosimetry career now. One, you can go to the school and become just like, any school as a science major, get your basic science curriculum, and then specialize on the next 2 years on the medical dosimetry program, and you can get that as a bachelor. Or let's say you have another degree in radiation therapy or any type of bachelor degree, then you can go to a certificate program where you'll be able to get another certificate and sit down for your medical dosimetry board exams. Or another option would be if you already have your bachelor degree and if you want to pursue a master's program, you can also go to a school that have a master's program in medical dosimetry and get your master's as well. The only thing about the three programs, it have to be accredited by the medical dosimetry board. And if as long as you went to an accredited program, all three paths would work. And the medical dosimetry accreditors are the MDCB boards. Okay, what does it require for us to become a good medical dosimetrist? You have to be technical, your skill have to be strong, analytically, mathematically, be able to work with people. We as a dosimetrist, we are the liaison to the whole group of people. We work with radiation therapists, we work with the medical physicists, we work with the radiation oncologist. So at the end, we have to be able to communicate with all three groups as well as the nurses as well. We have to be very detail oriented and be able to communicate effectively with all groups. Our field is constantly changing. With technology is always in the front of what we do. Therefore, we have to be able to adapt to all the technology that is around us. The softwares, the treatment plans, they are always changing. And then on the top of that, we're dealing with PET, CTs, MRIs, MRI guided radiation therapy treatment. All these things are always changing. Therefore, we have to be technologically savvy as well as very ready to learn new things at all time. Okay. Career opportunities. There are so like right now, especially with proton and like when we are talking about radiation therapy, is the radiation type also is different. We have proton therapy, we have just photon therapy, we have brachytherapies. Like all of these things are all falling under the same umbrella, which is the radiation therapy treatments. And with our career is expanding and allowing a lot of younger group of people are coming in. So the opportunity is wide open. There is clinic research in school as an educator, in in software development and things like that. So the career is wide open, and the job markets are very, very demanding right now as well. So we are in demand. The salary can range from, depending on what state that you are, you can range from high 90s to, like, as a straight out of school, from high 90s to 120s straight out of school right now, depending on which state that you are. But it's highly in demand. The amount of work that we have to do is very strenuous, so it's highly in demand. And that's all I got. So any questions for me?
Thank you. We'll take questions after all of the presentations.
Okay,
All right, so we're going to move right along to Camille Gilbert, who will talk about both medical assistance and being a CNA. You're still muted.
Hi, good afternoon, everyone. My name is Camille. Thank you, Dr. Maynard, for this opportunity to be able to speak to the students about medical assistant and CNA. So today I will be talking to you about what is your profession. I'll define it and explain it. How did I discover this career and when did I actually decide it? And what training and professional routes did I take to get to where I am currently? And what are the pros and cons of being in this career? So a little bit about myself. My current profession is actually a caretaker. I'm currently taking care of my mom, who's been diagnosed with stage 4 metastatic cancer last year in July. So since then, I've been taking care of her. But prior to that, I uh, I was doing CNA, Certified Nursing Assistant, and what that is, it actually provides basic patient care under the supervision of a registered nurse or a licensed practical nurse, assisting with daily activities, monitoring vital signs, and ensuring patient comfort and safety. And medical assistant is also, it's a vital healthcare professional who work under the direction of physicians, performing a mix of administrative and clinical duties to support patient care and keep medical office running smoothly. So with medical assistant, you will find medical assistants in private doctor offices, in specialty offices, CNAs, you will find those more in the hospital setting or in nursing facilities or rehab facilities. How did I discover this career? With medical assistant, that was actually my first my medical job straight out of high school back in 2004. And as soon as I graduated from high school, my first job was to work in a doctor's office, which I was blessed to do. And that is actually where I developed a lot of my skills and knowledge about medical assistant. And I've been at that practice for 7 years. So within that 7 years, I learned so much um, within that field, medical assistant. But I was going to college. I was studying at the time for my business administration and management degree. So I was trying to find out where the two correlates, but down the line, I know it would connect somehow. So, so that's how I arrived at becoming a medical assistant. I then studied for my license and I was able to achieve my license with knowledge and some schooling, which I will discuss in the next slide. And with CNA, I discovered CNA about 2 years ago, well, more than 2 years ago, about 4 years ago, working in the hospital setting, which I was the hands and feet of the nurses. We did everything where it's more so of bedside care. So if you're thinking of, doing bedside care, um, CNA is actually a fulfilling job because you get to work along with the patients directly. You are that individual that actually gives them a sense of hope because you're there with them every day, sometimes 12 hours a day, depending on the type of shift that you have. So the training and professional route that I took to become a medical assistant, for me, it took me 9 months to achieve my diploma because I already had my bachelor's degree. So a lot of my credits and courses that I had with my bachelor's actually went towards my medical assistant diploma. So you can obtain a diploma, a certificate, or an associate degree, which can be obtained within 4 months or 2 years, depending on the program. And then you also have to pass a national certification exam through the National Health Career Association. With CNA, um, it took me 6 weeks to achieve my CNA license. However, completing a state-approved program, 4 to 12 weeks, you have to pass a state exam, which includes a written and hands-on competency skill. And with this career, you can obtain other license for other states by completing a reciprocity. So What do I mean by that is I currently have my license in the state of Virginia. However, I have it for Montana and Maine. And all you need to do is just once you have an active CNA license, you can submit your license to the Board of Nursing, and then you'll fill out this reciprocity form and you'll be able to get licensed within that specific state. So you have the ability to become licensed in all 50 states if you choose to. And if you do so, it will put you at um, you'll be able to have vast opportunities of finding a job in the CNA field, and it actually puts you in a better position of being able to travel. So some of the pros for both careers, it's quick entry into healthcare. For those of you who do not want to take a longer time in obtaining a degree or maybe spending a couple years in college, you can go this route and still be able to be successful. It's job stability. It's very high in demand because they're always needing of medical assistants and CNAs. Like right now, in the hospital setting, the CNAs, like I said, we are the hands, feet, legs for the doctors, for the nurses, for everyone. So we always have, there's always opportunities, job opportunities for us as well as medical assistant. There is advancement for medical assistant. You do not have to stay at that level. You can actually go above in becoming a lead medical assistant, where it's more so like a supervisor position. Um, the duties will still be the same, but it will be more limited. So you'll be more administrative and supervising other medical assistants. You also have travel opportunities. There are travel medical assistant opportunities that you can look into. So if you want to enter into a career where you like to travel, you'll be able to do so. You take on contracts. 13 weeks is the minimum for your contracts, or you can extend it to however long you would like it to go. And that's for both medical assistant and CNA. And then with CNA, the flexibility with schedules. With CNA now, if you're working in a hospital setting, you can work 3 12-hour shifts and off the next 4 days. So that will give you the opportunity to make overtime. Everywhere you go with a CNA position, that will be the scheduled or 5 8-hour shifts. So you can make a decision, whichever one fits your schedule. You could do 3 12s or you could do 5 8s, and then you still have the ability to make overtime. The cons of these professions, um, the duties are repetitive. So every day you come in, you know, you get your charts, you see your patients, you do vital signs, um, and you do the paperwork. With CNA, you come in, you see your patient's bedside, you take them, to the bathroom, you take them to where they need to go, and whatever. If you're working in a nursing facility, the routine is a little bit different. Um, it's very demanding physically in the CNA position, in the CNA field, because it's a lot of moving, it's a lot of lifting. Because if you're working in a nursing facility, you have patients that are bedridden, you have patients that needs assistance, or they're one assistance where you have to help them walk with walking, you have to help them with their ADLs, activity daily task. So you have to make sure that you're fit enough to be able to lift them. They have machines, so you won't be able to use your hands. So there's machines that's provided for you to be able to lift the patient if the patient needs to be lifted. Exposure to illnesses, yes. Working in the medical field in this profession, you are exposed to a lot of illnesses. So I would recommend that you make sure you take a lot of vitamins and you eat well so that way you can stay healthy. And then the working environments can become a little bit stressful, especially if it's short staff. Then that leads you to having um, the brunt of the schedule or the patients rather. But all in all, both professions are fulfillment. You can gain knowledge and success with both professions. So I encourage you to look into either or. Thank you for this time, and I'll answer any questions if you have any later on.
Thank you. We'll move right along to Gabriel Dang.
All right. Hello, everyone. I unfortunately don't have a fancy PowerPoint slide like everyone else did. Was a little bit busy in the ICUs these past few weeks. But my name is Gabriel Dang. I'm a physician assistant currently in the critical care PA residency at Johns Hopkins. So we do rotate through almost all of the adult ICUs at the downtown campus and at Bayview. So, first off, what is a physician assistant? We're PAs for short. We're licensed providers. We work alongside physicians and nurse practitioners in terms of the clinician team to take care of patients. We're able to perform physical exams, diagnose and treat illnesses, order and interpret, lab tests and imaging, prescribe medications, be first assist in the OR in the surgical setting, and then also, perform bedside procedures as well. So I kind of stumbled upon this career, I would say somewhat by chance. My pathway wasn't a very classic pathway to PA. I originally got my bachelor's degree in culinary science and food service management, so a very different field, right? And so I was working in restaurants, country clubs for a while, and I happened to have a little accident. I fractured my elbow and I ended up in the ER. And as I was sitting in the ER, my arm was starting to lock up and I had like blood all over my face. I had like a little, a skateboard accident. I was smiling though. I had, I guess, my epiphany, if you will, at that moment. And I was like, this is exactly what I want to do, in the sense of being someone that can make others feel comfortable and safe and know that they're going to be taken care of, especially in a field that is seen as so foreign to much of the general population, where the medical field is filled with so much jargon and so much just different terminology that sometimes it does feel like, you're speaking a whole different language. So at that moment, I knew I wanted to go into healthcare, but I wasn't sure exactly what. So I did what anyone else would do, and I just started perusing Google for careers in healthcare. And I knew I wanted to be a provider. I knew I wanted to understand why things are happening and really truly understanding the pathophysiology of things. But I was impatient, and I knew that the MD DO route was not for me. I just personally was not willing to wait that long to be able to get into the field. And so I saw that PA was kind of the perfect route for me. PA school requires a bachelor's degree, clearly in anything, as per my own personal background. But as long as you met their prerequisites. So you did have to take science courses. So I took extra science courses at a community college, and then you had to have a certain amount of patient care hours. And so I got that by actually going and getting my CNA and then PCT, which is a patient care tech. Um, and so hearing Camilla talk about her, pathway, I was like, this is bringing back a lot of memories for me. So I did a accelerated CNA into PCT course over like the winter break. It was like a 4-week program. And then from there, I was able to apply as a patient care tech at the hospital. I then applied, and it was to a step down unit, which is like a level right below intensive care unit. And on my very first day of orientation was in March of 2020. And that was the first day of orientation was when our hospital got our first COVID admission. And so adjusting to a completely new field, and then 2, adjusting to the whole healthcare system, adjusting to this pandemic, was a definite trial by fire. So our step down unit then transitioned into a non-COVID intensive care unit, and that was really where I felt like I fell in love with critical care itself. Seeing patients very acutely clinically decompensating and having to make very quick decisions on what to act on and what not to act on, and when to intervene with a procedure such as an intubation, or when to start, medications that would increase their blood pressure, so vasopressors. That very fast-paced setting spoke really well to me, and it really caught my attention. And I think part of that as well came from, strangely enough, working in restaurants. I think working in a very fast-paced environment, where you also have to, think quick on your feet, and there's a lot of commotion going on, but it's controlled chaos. And working in a very tight-knit team that works very effectively and very efficiently. And that was why I think that's why also the ICU spoke to me, just because it has actually a lot of similarities to working in a very busy kitchen. So then that's kind of why I leaned towards critical care. However, with being a PA itself, PAs are able to almost work in any setting. We work under the supervision of a physician. And I know nowadays they're starting to change the wording so that we work alongside them. But a lot of the training after PA school is about 2 years, and it is very intensive. It's a master's program usually, and PA school trains you to be a very well-rounded family practice provider. And so if you want to go into something more specialized, you can do that. And a lot of that is just willingness of the physician that you're working alongside to want to train you on their specific, field. One of the best parts about being a physician assistant is the ability to be dynamic in the terms of interests of specialties. You are able to switch specialties at your own will. You don't have to do a full residency or anything. And it's as long as the physician that you work alongside is willing to train you, then you can switch from critical care to pediatrics to neurology to general surgery to honestly pretty much whatever. I think one of the big things would probably still be like anesthesia is one of the things that we're still not able to do yet. But for me, I felt like intensive care was for me. And though I was, there are places that take new graduate PAs, I felt like a residency fit me better just because of um, the structure. Um, Other things that I enjoyed, PAs overall have really good work-life balance. Um, I've met so many physicians as well that have said, if I could go back and do it again, I would probably go the PA route. But again, I think physicians also are much needed in terms of their deeper knowledge and understanding of the pathophysiologic, um, you know, factors of a lot of illness, disease. And, you know, PAs do a lot of that as well. But I think the physicians really have just like another layer to that. And I think one of the big things, though, is that in terms of cons of being a PA is, and similar to anyone that works in healthcare, is patients that have more of a poor prognosis that unfortunately do pass. And that is the reality of working in healthcare. And especially more so in an ICU setting of, you're trying to do everything that you can for this patient. And, at the end of the day, it is sometimes just their time. And so it is something that, you will have to come to terms with. But again, that is a thing that is kind of universal in the healthcare field. Otherwise, the other thing would just be the general public consensus and understanding of what a PA does and is able to do. But we're getting better representation through associations and stuff to kind of get a better representation of what we do. But that's kind of a quick rundown of what a PA is. And thank you so much, Dr. Maynard, for having me. And I think you could open up for questions.
Awesome. Thank you so much.